Hello everybody. Today we are going to talk about spinal canal stenosis. Let's start by knowing what is spinal canal stenosis. Spinal canal stenosis is, as you know, the spine is made up of 33 vertebrae, 33 bones. These bones are stacked on each other like bricks, and in between are disc, and in between goes the nerve, which is the spinal cord. So when the spinal cord is going through the vertebrae, there is a canal. The space for this canal, when it reduces, is known as spinal canal stenosis. Now, why does this happen? Well, there are multiple reasons for this to happen. It can range from just simple degeneration to infection to a slip disc to any other tumor or any rare things. But the most common reason for spinal canal stenosis is degeneration. So, where with age, with degenerations, as the bones in the joints they start rubbing each other, the same thing happens in the spine. As you see, the facet joints, the disc, they start getting degenerated, and then the canal which is there starts getting smaller and smaller. So it causes compression, and that is because the area has come down. This is known as stenosis. So most common is degeneration. You can have trauma where there is a fracture which can cause decrease in the canal diameter. There could be infection, there could be tumor, there could be n number of reasons which we say secondary, which can cause the nerve to get compressed. So there are multiple reasons for spinal canal stenosis, but the most common is degeneration, or we can put along with degeneration in the younger patients a slip disc. So now, what are the signs and symptoms of spinal canal stenosis? As I always try to explain to my patients that if the tube light is off, the problem can be in the tube light, the wire, or the switch, or the main switch. The switch is the spine, the nerves going around from the spine to, from the neck to the arms, back to the chest, and low back to the legs. Anywhere in the spine, if it gets compressed, gets stenosis, then the signs and symptoms are seen in the legs. So it's a very common question. Why are you taking my uh, investigating or treating my back when my legs are hurting? So most common sign of a spinal canal stenosis is a leg pain, or in common words, sciatic pain, sciatica, different types of pain. So pain in the legs, tingling, numbness in the legs, not able to walk a particular distance. Like you say, I walk 100 feet and I have to stop because my legs get heavy. So heaviness in the leg, not able to walk. These are all the signs of spinal canal stenosis. So, as I said, 80% is degeneration. You cannot stop degeneration, but you can slow it down. Like you cannot stop graying of hair. So, spinal canal stenosis is going to happen. What we can do is to slow it down, and that is by regular exercises. And the most common exercise, as we advise, is walking. Walk as much as you can, and that will help in preventing the spinal canal stenosis to go bad. And a few exercises for your abs, back, that is also going to help you in spinal canal stenosis treatment. More than what you do, what not to do is equally important. As I put it to every person I meet, you don't lift while bending. If you want to lift something, there are different ways of lifting it. So you have to bend on your knees, the hip rather than a spine. Don't sit for more than 45 minutes at a stretch. Very important, because these are the small things in your everyday life which you change, and you can prevent a big problem from happening. So as we say, stitch in time saves nine. So don't sit for more than 45 minutes at a stretch. You want to sit, take breaks at 45 minutes, walk for a couple of minutes, again sit. You can do that the whole day, but don't do it at a stretch. So now, as I said, 80% patients may not require surgery, and you may not have severe symptoms. But how severe can it get? Well, if you are not able to walk much, if you are not able to do your regular activities, you are not able to manage your everyday life, what we say everyday uh, activities of daily living, like going to the bathroom, walking around your house, and your legs are hurting 24/7, then it may lead to what we say neurological deficit, like your loss of bowel and bladder sensations, you're having weakness in the foot, like foot drops, or in simple words, paralysis in the legs. So if you neglect a symptomatic lumbar canal stenosis, it can lead to a lot of weakness in the legs, urine toilet issues, and your everyday activity is affected. So any problem you face in your spine, from your neck to your tailbone, we have all the solutions. So we are spine, we take care of your spine always. Thank you.